Hi, everyone. It's Selena here at CE Institute, one of your instructors. And today I'm going to show you how to work on the forearm flexors. First, I'm going to show you on a live model so you can see how it is usually practiced. And then I'm going to show you how I adapted it so that we can work on ourselves, because what massage therapist does not need work on their own forearm flexors? It's fabulous work, folks. I learned this technique in a Paul St. John neuromuscular seminar over 25 years ago, back in the 90s. So, this is an active release technique because we are going to open our hands. 1,000, 2, 1,000, 3, 1,000. We usually open within 3 to 5 seconds and then close every 3 to 5 seconds. We want to open and close nice and slowly because we're going to be applying pressure to the forearm flexors as we're opening and closing. Okay. And you're probably going to have a really hard time opening as we're applying pressure superiorly. That's okay. We're stretching, releasing adhesions, and more. And that's something that we want to feel. Never work above a 7. On a 1 to 10 scale, when you're doing this work, it can get pretty intense, and you should be a licensed healthcare provider. People who are not already trained with rudimentary knowledge of precautions and contraindications should not be following along with this. You should have basic training prior to working on yourself or others to ensure that you're doing no harm. Now, let's review what this looks like on a live model. Okay. The hand is off the side of the table, and I'm going to brace the hand with my own hand so that it's not like feeling like I'm teetering or pushing them off the side of the table here. So just like that. I'm inserting my first knuckles here. Okay, your first knuckles are the most proximal interphalangeal joints, okay, closest to the metacarpals. And we're going to insert our first knuckles right above the client's carpals, and we're going to move superiorly with a good amount of pressure. I might be doing about 10 to 20 pounds of pressure here. What the important thing is, we want to release pressure a few seconds into the stroke because otherwise the client's going to bruise. So you're going to see me lifting my fist in a minute right here and then back in as the client continues to open and close their hand. Okay. Make sure you're not standing too close to the hand. Several times I've seen therapists, the client's hand is almost in their pubic area. You have to stand to the side or stand a few inches back to ensure that you do not have that type of contact. Now, the client's opening and closing their hand very slow. We're going to be releasing pressure here. If you don't release pressure, it can be even more intense. It's actually blood circulation trapped in those capillaries. It creates little pencil-sized bruises if you do not release pressure somewhere in the middle of that stroke. Okay, so we're going up a little bit medially here. I'm pronating the arm so that we can reach some of the flexors in and around the radius, and I might be even catching some of the forearm extensors. If you want to do the forearm extensors and more, please come to the school for training or take some of our online training options. Those are available as well. Now that I've shown you what that looks like on a live model, we're going to move over and try this on ourselves because, again, what massage therapist does not need their forearms worked on? And sometimes it's hard to get other people to swap with us or trade or even get an appointment for ourselves. So it's good to have some self-care practices, and this is one of them. This is a training unit that is part of our neuromuscular therapy home study training. And I want to bring your attention to here at CE Institute, while this is an active release technique, we also have practices called strumping. Strumping is stripping and pumping a joint at the same time. We're usually moving a joint through a range of motion. It could be passive motion or active motion where the client's moving for us. In this case, it's active motion. And we're going to be applying pressure while that joint is going through range of motion. So we're strumping. So there's many different names that you can call this technique: active release technique, art, strumping, stripping, myofascial release. All of them would apply and be appropriate for this technique. Now we're going to do the forearm flexors. You don't need to let your hand hang over the table for this because while your hand is supinated, it's very easily openable. You can open and flex your fingers and extend and open your fingers, right? So we're going to continue that active movement of opening and closing your hand every 3 to 5 seconds with movement in both directions. We're going to continue to use our second knuckles. We're going to insert our second knuckles just above the carpals, and we're going to start opening and closing that hand. It doesn't have to be tight hand squeezes. We're going to release pressure to allow blood circulation, and we're going to continue all the way up to the cubital fossa, opening and closing. Now we don't massage back down. This is not a massage, it's neuromuscular therapy. We're trying to achieve function here, releasing fascial adhesions, releasing muscle tension, increasing circulation to relieve ischemia, and more. We'll do it one more time on this side. Second knuckles above the carpals. We'll do this a little bit more medially. I'm going to start opening. We're going to pull back superiorly or proximally towards cubital fossa. And that's how it's done. Let's switch hands. You can do this as many times as you wish. This is just a little practice session so we can do it all together. Again, second knuckles, pulling backwards as we open and close. Release pressure so you're not making bruises on yourself. Do not go in the cubital fossa. And work more laterally here. Ready? We're going to open right on the top of the carpals there. Open and close. It's easier to close with this than it is to open because we're pulling on the flexors. Open. And don't go in the cubital fossa, and close. And that's strumping and stripping your own forearms.